Hello, my name is Lauren Scholler. I am a board member at Miles4Hips, and I'm joined today by Kait Williams, who is an occupational therapist and also has experience as a patient. And she is an excellent patient advocate, and we're excited to highlight her and her expertise during this year's Team Week. Thank you for being here, and we're really looking forward to this conversation.
Yeah, thank you for having me.
Of course. So to start, do you want to share what an occupational therapist is and how long you've been an occupational therapist and kind of what motivated you to get into the field?
Sure. So, occupational therapy helps people of all ages and with a variety of diagnosis participate in their meaningful activities. So, the example that I like to give is if you have somebody who has arthritis and their favorite occupation is gardening, we help them learn how to garden again, maybe by like raising the garden beds so they like can adapt and still continue to do what they love to do. Occupational therapy is very client centered, and we focus on the occupations that are important to the patients as well as the performance skills that go along with those tasks. So these occupations and performance skills are dependent on the environment that the clients engage in as well. So, for example, if there's a child who is able to navigate their home safely, but at school they have difficulty navigating their environment, OTs will step in and help support them in that environment as well. And then another key thing to occupational therapy is we focus on independence in activities. So, for example, if after surgery somebody has trouble getting dressed, we will break down the dressing task and we'll determine like what the areas of need are. And then we either modify the task or we adapt and we teach the skills that are needed to complete their everyday activities. I have been an OT for almost 7 years now, and I decided to pursue this field because I fell in love with how client-centered the profession is and how we focus on what's important to the patients or the clients.
Awesome. Thank you for sharing that. I feel like the role of an OT with how like patient specific and patient tailored it can be is so important to just like giving back independence to patients in their activities of daily living. So it's definitely such an important role. Um, so do you also mind sharing kind of what your experience as a patient has been in terms of I guess, what you want to share, what your experience and perspective has been?
Yeah, so I kind of have a long road as a patient. I'll explain a little bit about my diagnosis over time, but when I was around 13 years old, I started having leg pain and I thought it was normal because I was a runner. I was like, oh, like it's just from running. But then when I was 23, like I had some pretty bad hip pain. And so I went to the doctor and I was diagnosed with femoral acetabular impingement and a labral tear in my right hip. So I ended up having surgery to address that. But then a few months later, I still had some pretty significant pain. So I realized that the scope had failed. And when I had further imaging done, um, I ended up with two impingements rather than the one that I went in for. So then I got another opinion, and I ended up having my right hip fixed and then also my left hip done as well. But then like when I started returning to running, because running is my favorite occupation, I realized that like I still had a lot of pain. And then it got to the point where I felt like I could barely walk. Like I walked with a really bad limp and it just like never seemed to go away. Um, and I strongly believed that I had alignment issues. And like ever since I was a kid, I noticed that my femurs like would point in and my tibias would go out. And so I decided to try to find a surgeon or a doctor that could help me like with those alignment issues. And look more at my body as a whole rather than just like the hip joint or the knee. Um, and I ended up finding a really great doctor here in California. and he diagnosed me with miserable malalignment syndrome, which essentially means that like my femurs were pointed inwards and my tibias would go out. So then I first had a femoral osteotomy on my right leg, where they cut the femur and then they rotate it and hold it together with a plate and screws. And then I think it was maybe like 8 months later, I had the same thing done to my tibia. Um, and then most recently, I ended up having a labral reconstruction because like my labrum was still torn pretty badly. And then right now I'm kind of in between surgeries waiting for my left leg to be addressed. So it has been a really, really long road. But I can say with confidence that my right leg has been so much better. And it's really great to see at least one aligned leg.
Yeah, that sounds like a long road for sure, but I think something that like is very evident is how you have advocated for yourself throughout that journey. And so I was wondering, like, as an occupational therapist who, you understand parts of the medical system, how did you navigate building your medical team and advocating for what you needed as a patient while you were trying to get those diagnoses?
I mean, so after my first surgery, when things went wrong, I realized like how important it is to do your research, um, not only online, but like talking with people about their experience. That helped me significantly. And also kind of like treating this person who might be operating on you kind of like in a job interview, right? Like you are like questioning them and testing them and trusting them with your body. So I would definitely say that. And honestly, like intuition too. Like I didn't get a good feeling after my first surgery, and I should have listened to that, but I didn't. Um, and I had really good feelings about the two other surgeons that I have worked with. Um, so I wish I could say like more of like an OT answer, but really it's just kind of like how I personally felt, because only I could know, how it feels.
Yeah, no, that makes sense. And I think something that is talked about, a lot in the hip dysplasia community and patients with more like chronic medical conditions is getting a second opinion and making sure that you feel confident in your medical team. And it sounds like that was really instrumental in your journey and in your care.
Definitely. Yeah, you want to feel good about it because like if something doesn't feel right, like that can really affect your recovery.
Absolutely. Yeah. And are there any tools that you learned as an occupational therapist that have helped you through your surgeries?
Oh, I have learned so many, so many tools. I think some of the biggest things are like how to modify my home, because safety is like the number one priority for an OT. But also after surgeries, like, you don't want anything to happen. So like making sure that you like remove the clutter in your home or remove rugs so you don't trip over it, and making sure you have like your medical equipment set up, like your commode and your shower bench, in the way that's like safest for you to complete those tasks. Also like using adaptive equipment like the sock aid. I don't know if you've seen one of those, but
Yeah.
they're so fun. Or like a reacher to help you get dressed, or like a shoehorn to help you get on your shoes because sometimes like with hip, like you have hip precautions. Like the most recent surgery I had, like I wasn't supposed to lean forward, so I needed those tools to help me. Um, and then I would also say like how to advocate for myself, as you said, like I feel like as an OT, it's really natural for me to advocate for other people, but when it comes to myself, I'm like, oh no, like I don't know if I can do it. But I find it really important, like if somebody isn't able to advocate for themselves, like having somebody like with you. And there's definitely been times where it's like I need somebody, like an outside, like like a friend or significant other, whoever like with you, somebody who's in your corner. Like really that's like one of the biggest things that I have learned as a patient and as an OT.
Absolutely. I think that's really powerful. And I think there's like a lot of intersection of your like role as an OT and also the things that you've experienced as a patient. And kind of going off of that, can you share how the field of OT intertwines with the journey of someone who has hip dysplasia or other lower extremity orthopedic conditions? And like, how would the addition of an occupational therapist be beneficial to, say, a hip preservation team or an orthopedic team in general?
I would say that OT intertwines with people with lower extremity conditions because like we help people do those everyday tasks safely and independently. And I think independence like is a big thing, something that like I realized as, as a patient, like when I like had to wait on somebody to, help me with something, like it was always kind of hard and like sometimes like it makes you feel kind of down. So like having the tools to help you do those things independently and as I said safely is really important. Um OTs can also help with like with pain management, which, after surgery or even like before surgery, the pain that you're experiencing. Also energy conservation, we can help like modify tasks to help save your energy and so you're not in so much pain. Yeah, and do the things that are really important to you.
Yeah, I think the role of OT in like my journey with hip dysplasia was really like highlighted after my most recent PAO. I have had both of my hips done, and the first time there wasn't an occupational therapist on my team, and then the second time, the hospital that I had it done at, they are now making it routine to have an occupational therapist see you before you're discharged.
Right. Yeah.
And just the tools that they provided, and the resources, like you said, when you're going from being able to be quite independent before surgery to then you're relying on a lot of help afterwards, it can be really empowering to have those what can seem like seemingly small tools, like being able to put your sock on your own, or being able to like navigate a kitchen, with crutches. That was really empowering, like to be able to have those tasks that yeah, I was enabled to do through those tools that I wouldn't have been able to do otherwise.
Yeah.
Um,
So there's this quote that we use in OT. It goes, "Medicine adds life to your, or sorry, adds days to your life, while OTs add life to your days."
I
And
love that.
I just love it. I mean, obviously you need both,
Mhm.
but yeah, I just find it like really powerful um, because it like it's your life like and you don't need to just like completely stop like doing the things that like you want to do or need to do because you have a lower extremity condition. There are ways um, that you can get help and do the things that you want and need to do.
Yeah, I think that's such like an important perspective and a reminder to have that there are resources out there to help you to be able to navigate and get, through conditions that you have. And I think that's where OT plays a special part. Kind of going off of that as well, if a patient feels like they might benefit from OT services, whether it's, they're inpatient or they're at home, navigating their immediate post-operative recovery, really at any time in their life, if they feel like they need OT services, what are ways that they can find those services?
Right. So a lot of times like for example if it's a child, I believe that it's like a pediatrician that would refer them to OT. So like if they are having, significant issues with lower extremities, and having trouble with like, their daily tasks like getting dressed independently, or like one of like the biggest occupation for children is play. Like, are they able to engage in play? Then they might be referred to OT. Um, if you are in the hospital post-operatively, like you said, like most of the time you will get an OT that will come in and do an assessment and see if OT is warranted. And they will like usually evaluate you before discharge. Um, and they'll make sure that you are able to do like dressing and sometimes bathing or transfers. Um, and then sometimes you might get it like as a home health service if the hospital, like once you're discharged, if they believe that you still, need that care, they will order it, or like your surgeon will order it as well.
Okay,
But like
that's
some things to look out for, like if you like, if you do suspect that you might need help, is like if you ever think that your safety is at risk, if you have like difficulty with strength, if you're having difficulty completing like your daily activities, if your independence is impaired, also like caregiver training and education, like that's definitely a place that OT can help.
wow, that's great. That's really helpful for sure. I think like being able to know where to find those resources can alleviate some of the like stress post-operatively or really at any point when you're trying to navigate how to put together the best team. So that's definitely helpful. And just kind of as a closing question, what advice do you have for someone who has just received a diagnosis of hip dysplasia or labral tears, or any kind of like diagnosis that may feel like it has a daunting treatment course ahead?
Yeah, I have a lot of advice. I've been doing this for years as
Hmm.
a patient, not as an OT. I mean, probably like one of my top is like find the right treatment team, get a second, third, fourth, 10th opinion, whatever suits you, because that's your right as a patient. Like I said, you want to feel good about it. On that note, I would say find a surgeon or a treatment team that listens to you, um, listens about, like what pain you're experiencing, and what's important to you and what your goals are. So the surgeon that I'm working with like is amazing at like he knows that my ultimate goal is to get back to running. And so because he knows that goal, like I feel like we're a really good team because like he understands, that that is what's really, really important to me. Um, so find somebody who listens and who's in alignment with your ultimate goals. Um, and then I would say, find a really good support system, like surround yourself with family and friends, um, healthcare professionals that do support you. And because it is a scary time. Um, and yeah, it's a difficult one. I would also say my plug is an OT. Plan ahead and make sure that your environment is safe. Because we don't want to fall or anything. Um, so yeah, I would definitely say safety, following your protocols, whatever the protocols that your surgeon gives you or your therapist give you, because that is the key to getting stronger and will help you in the long run. And be patient with yourself because recovery isn't linear. There are ups and downs to it, but you will get through it. There is the light at the end of the tunnel. Um, and then lastly, I would say like don't give up and keep moving forward. Like don't lose sight of what your goals are. Um, and I really hope that like I don't lose sight of my goal of running again, and I will do whatever it takes to get there, because of the help of the medical team that I have in my support system. So I hope others, don't lose sight of their goals too, because you will get there.
Yeah, that's really powerful and important advice. So thank you for sharing that. I think that's going to resonate with a lot of people. And I have found this whole conversation to be just so insightful. So Thank you for providing your perspective and being such a valuable resource to patients and families.
Great. Thank you very much.